I'm a public health professional, and I think one of the things that appealed to me about active transportation in general is just all of the different ways in which it really improves public health. So in terms of climate goals and air quality, physical activity. I think in terms of my advocacy role, things really started taking off, both because I have young children and I want to see them be able to get around in the city of Berkeley in a safe way. And then unfortunately, a good friend and colleague of mine, Meg Schwarzman, was hit and very nearly fatally injured. And that really, I think, spurred on my advocacy hat and really wanting to make transformational change happen really quickly.
So I have a public health background, and I have lived in a number of different locations where I've bike commuted and been a pedestrian, and in the last 6 years in which I've lived in Berkeley, I've been raising small children. And it's really been that experience, I think, of trying to help my family to get around town without using an automobile that has spurred me into really wanting to focus on what kind of improvements we can make here locally to keep people safe when we're out on the streets.
We have kind of 3 different strategies. We really are trying to engage the community, and we're a relatively new organization. We've been around about a year, so that's a big new project for us, is trying to bring in lots of different people into the fold of walking, biking, and rolling in Berkeley. We are working with the city of Berkeley and using their regular planning process and going into the spaces where they are already doing work and making sure that our voices are heard and trying to really advocate for folks who want to walk, bike, and roll in Berkeley, and then also picking some of our own goals that we really want to advocate for in the city. So I think the key elements, at least for me, I'm thinking more in terms of like an active transportation system, a healthy one, is that number 1, it be data driven. Number 2, that it be really equity focused and really bring in all community members who have an interest.
I will say that the very first action that I helped organize that really, I think, gave me further confidence in establishing this organization was a pretty simple idea of going out to an intersection and acting as glorified crossing guards. This is an uncontrolled intersection on a bicycle boulevard and has been, a problem spot for a long time. And so we went out and we helped people cross during the morning commute. We held up signs and people in their cars honked if they supported walking and biking, and we helped many people get across the street in a more safe and low-stress fashion than they would have otherwise. And the lesson learned for me was that simply getting out in the street and doing something with people forms community, makes people feel like they've contributed to something, a positive experience for other people. And guess what? Nobody got really mad at us.
An ongoing project that we're working on is the Milvia Street Bikeway. Milvia Street is the main thoroughfare through downtown Berkeley. It's the most heavily used bikeway in Berkeley. It's also the bikeway with the greatest number of bicycle crashes and injuries. And so we're really working to get some protected infrastructure on Milvia.
I really feel like in urban environments, and Berkeley is becoming a more and more urban place, that we need to use every available opportunity to give people more options for living and a more active lifestyle and choosing alternative commute modes. So I'd like to see a culture change in that respect. And I think if we see that kind of culture change, it makes all the difference in terms of being able to really move forward quickly in making our road environment safer.